Thank you, Mr. President. I come to the floor today as the Democrats continue to scare the American public when it comes to their health care. This week's Democrats' presidential debate the other night in South Carolina was a free-for-all. Their frontrunner, a man I believe to be a dangerous Democrat socialist, Bernie Sanders, is in the spotlight, and he seems to be in the lead. Socialist tax and spend policies remain on full display. The top policy priority of the Democrats would destroy health care freedom in America. They're proposing a complete government takeover of our nation's health care system. Complete government takeover. They call it Medicare for all, but let's take a look at what that actually means. It means for 180 million Americans who get their health insurance through work, they would lose that insurance. They would lose that health insurance. And Washington bureaucrats would be in control of health care decisions. The Sanders proposal has a price tag of over $34 trillion, $34 trillion with a T. It would bankrupt the country and everyone in it. The only way to even try to pay for it is with massive across-the-board tax hikes. And Bernie Sanders said he's willing to do it. Do not be deceived when they first talk about targeting the rich, because the tax increases would hit working families, even people making $29,000 a year. That's according to Bernie Sanders' own math, and taxes are likely to double. Medicare for all would deliver a crushing blow, not only to family budgets, but I believe to the entire economy. It would end America's success story. Thanks to Republican tax and regulatory relief, we have a record-setting economy, record low unemployment, record job growth, 7 million new jobs. Wages are rising, middle-class wages, blue-collar wages going up. It is a worker windfall, a blue-collar boom. A record 61% of Americans say they are better off financially than when President Trump took office. People are confident about the future, and the president's job approval is at an all-time high. But still, the 2020 Democrats don't seem to get it. You don't hear a positive word about the economy. Instead, Democrats seem to attack one another and try to move further and further to the left. During the debate last week, the crowd actually booed a defense of free markets. Some Democrat candidates are proposing a scaled-back version of Medicare for all that they call a public option, but this proposal would create a government health plan to compete with work-sponsored health insurance. Again, don't be fooled. That public option would hurt patients across the country, especially people living in rural areas. It would disrupt insurance coverage, slash funding for doctors and hospitals, and would force local hospitals and clinics to close. Simply put, a public option is a pit stop on the road to 100% government-run health care in America. Clearly, Democrats are ignoring their own voters. Union workers across the country are telling Democrats, don't touch our hard-earned health care benefits. People don't want radical health care schemes, which is what the Democrats are proposing. People care more about their pocketbooks. They want their own health care, but they want it at a lower cost. And that's what I hear every weekend at home in Wyoming. Americans are struggling to pay for insurance premiums for doctors, for hospitals, and for prescription drugs. According to a new Politico Harvard poll, 8 in 10 Americans, 8 in 10, and it's 89% of Democrats, 76% of Republicans, want us to lower their health care costs. 75% say we must lower the cost of prescription drugs. I agree. The Kaiser Family Foundation reports nearly 1 in 4 people are having trouble paying for their prescriptions. But socialist policies are the wrong medicine. They will only worsen the problem. Republicans are listening to people's concerns. We have common sense solutions to lower out-of-pocket costs without lowering standards. Now, I'm a doctor, the husband of a breast cancer survivor, the son of a 97-year-old mother. Let me assure you, Republicans will always protect vulnerable Americans, especially people with pre-existing conditions. The Republican health care agenda is about giving patients more choices and better health care. It's about improving health care access and affordability. Working with President Trump, we are already providing much-needed relief from costly Obamacare taxes. These unfair taxes hurt working families. They hurt small businesses. They hurt seniors. And we have ended them. Now we're working to drive down drug costs. As part of this effort, in December, I joined 6 Republican senators to introduce the Lower Costs, More Cures Act. This legislation would limit out-of-pocket drug costs for people with Medicare Part D plans. We also ended the drug price gag rule to help patients find more affordable drugs. We're working to end surprise medical billings. These unexpected, unreasonable, and unaffordable bills undermine families' finances. It's an intolerable practice, and it must stop. Republicans are delivering better health care. Still, to make more progress, we need Democrats to work with us. It's time to come together. It's time to cooperate. It's time to find common ground. Mr. President, I will tell you, taking away health insurance from 180 million Americans who get it through work is not common ground. There is no common ground there. That is the direction of the Democrat Party. We need to find common ground in taking insurance away from 180 million Americans who get it from work, and then giving free health insurance to illegal immigrants and raising taxes from Americans to pay for it is not common ground. Let's work together to give patients the high-quality care that they need from a doctor they choose at lower costs. Thank you, Mr. President. I yield the floor. Suggest the absence of a quorum.